Since journalists are found to have encountered numerous challenges in reporting health emergency stories, such as handling mpox-related issues, Ministry of Health, in collaboration with other partners, such as Africa Center for Media Excellency, World Health Organization, United Nations International Children's Emergency Fund, in Arua City on Monday, 18th of November 2024, organized a forum sensitizing the journalists on dealing with health emergency stories, more especially reporting on mpox, which continues to hit the nation. Dr. Edward Muganga, a representative of World Health Organization, urges journalists to avoid stigma reporting.
There are people who run out from their villages, homes. They can settle in other districts. Why? Because of stigma. Currently, as a ministry, we are doing research on the survivors of Ebola in Kasanda and in Mubende. Some people actually moved away from those areas to other districts. Why? Because of stigma. So how can we embrace this? How can we, in our reporting, how can we empower a survivor to remain in the village, to remain in that municipality or city? The role of the media in public health emergencies. This one is a standalone component which all of us should be focused on.
Anton Bugembe, Communication Officer for World Health Organization, encourages journalists to have community engagements with the local community members.
We realize that of recent, we have an increase in community transmissions. These are mainly among sexual partners. So this means that we need to have a lot of community engagement to address this. And then also we need to have research. As WHO, our immediate goal is to prevent mpox from reaching vulnerable populations and manage it. We know that we can use the media to dispel rumors, to address stigma, because we realize that stigma is a big problem when it comes to mpox. A lot of people who are living with mpox or who have survived mpox meet challenges getting back into the communities. So we believe that from your reporting, you can be able to instill the public confidence, one in the health system, but also to allow the survivors get back into their communities.
Aiko Stanley, an officer for United Nations International Children Emergency Fund, a regional office, similarly encourages the journalists to approach focal personnel in order to get the right information about mpox.
One of your key role is, of course, now participate during these meetings. That's where you're going to get the facts concerning where this disease is currently occurring, how many people are confirmed in various districts or in which facility. Even at health facility, you can get some facts because these confirmed cases are admitted in isolation units. So there also there is a focal person where you can get some facts. Even at the community level, they are trained health personnel that we call village health teams, who are trained to do community-based surveillance. So of course, sometimes they don't communicate directly to you, but of course, you can easily see the work they do as far as mpox response is concerned.
Meanwhile, Zaira Namuli, trainer with the Arua Center for Media Excellency, who doubles as the communication officer for Lung Institute in Mulago, says, as a journalist, you still consider the privacy of a patient when reporting about mpox.
Respecting patient privacy. As a reporter, you'll always be excited when you have this tip. You've been told that the patient is here in Ward 1, so you run with your gadgets, you're saying the name of the person, where they stay, where they are renting, and all those things. It is not necessary. Because at the end of the day, so what? Okay? You may think you have done a very good job, but what if it was you? What happens when this person cures and the mpox disease is not being talked about 20 years later? To communicate effectively, we have to be able to look at those things, credible sources, simplify jargons, and promote prevention measures. Don't report to scare.
In Uganda, over 500 cases across 34 districts countrywide have been registered with World Health Report. In July 2024, the cases increased by 8.8%, with age bracket between 20 to 29 being mostly affected. Oraku Benson Pastore, West Nile Television Nilecast.